Hello, I am Dr. Terry, MD, and I am a neonatologist in Dallas, Texas, and I specialize in the care of preterm babies and sick-term babies. And guess what? I am off today, Saturday. Yay! It's a rare Saturday off, so I don't even really know what to do with myself. But I do know one thing I need to do is I need to get my stream done for this week. And so I'm a little late with Terry's tips for this week. So I apologize for that. I will do better. I'm trying out my new snazzy equipment today. So you guys will have to let me know what you thought about the lighting and the mic. And I'm post calls, so I may look a little tired, but I'm excited to be sharing a little bit with you about what gives me passion. So as I shared, I'm a neonatologist here in Dallas, and one of my areas of specialty is perinatal palliative care. My mission is to support families who have very sick newborns who have to make difficult decisions, helping them navigate a difficult journey with respect to end of life decisions for their infants. And I also support providers who have to support these families who have to make really difficult choices. I like to say that my job is to provide light for the journey. So today, I just wanted to share what is palliative care and just share a few points about palliative care and what that may look like. One of you may find yourself one day having to support a friend who is experiencing the loss of a child or who may have a child that's critically ill. And we want to make sure that they are somewhere where they can ask for help with respect to palliative care and memory making, because often that families are not aware of some choices that they do have. So palliative care is care that improves the quality of the life for the patient, and for me specifically, that patient is a baby. So it doesn't always mean that the child has a terminal condition. It doesn't always mean hospice. Hospice is a part of palliative care, but it is not the whole sum of palliative care. So palliative care has many domains, and it involves supporting the patient to decrease pain and suffering and improve the quality of life. And for different patients, that may look different ways. When we're meeting with families who may have a baby that has a life-threatening or critical illness, our job is to find out what is it that the family would most like given our current scenario. So we may not be able to change the diagnosis, but can we change the quality of the time that they have to spend with their infant? Can we relax some rules so that they can have a better bonding and memory experience with their baby? So some of the things we do is meet with families and talk to them about a wish list. And on that wish list, we ask them things like, who do you want to be here when you meet your baby? Would you like to have family pictures with your baby? For some families, that's the first time they ever took a picture, was with the baby in the hospital who may not survive. Would they like to give the baby a bath? Is there a special outfit that they would like the baby to wear? Because the baby may never get a chance to wear it. Do the mother and father want to do kangaroo care? Do they want to do a special blessing? Most hospitals do have a chaplain, but some families may want their own faith representative there. They may not even know they could bring their own faith representative. So we want to ask them about that. Are there siblings that we need to talk to about why a brother or sister is sick? And do we need to have resources for that in place? So things like that. We may not be able to change the final outcome, but I believe with all my heart that we can give families a sacred experience that will be memorable and special for them, even in the most difficult of scenarios. We can also make it much worse by not offering them the opportunity to have a different kind of experience. Is there a chance that we can get the baby home so that the baby could be in his or her own bed? I have sent term babies home the very same day just so that they could sleep in their bed one time because that was a parental wish. So all of those things make up palliative care. In order to do it well, you need to have a multidisciplinary team, including physicians, nurses, social work, pharmacy, lactation, respiratory therapists, occupational therapists, physical therapists, all of those people working together to make sure that the family has a sacred experience as they prepare to say hello as well as goodbye to their infant. So those are a few things about palliative care. It's care that improves the quality of life for the patient. Its aim is to decrease pain and suffering. At its core, it is about patient choices, or in my case, parent choices. And three, it involves a multidisciplinary team. So I have learned a lot from families over the year about how better to support them. I believe that families who lose their babies should have as much support as parents who get to take their babies home. And we struggle sometimes with those conversations, and we as providers, it's incumbent upon us to learn how to do it better, and that is one of my missions. I enjoy helping providers learn how to do that, have those conversations, because I know in the end it will be light for the journey for a parent in a very difficult situation. And the last thing I want to share before I go and try to enjoy my Saturday, and I hope you're going to enjoy your Saturday too, is this very nice innovation from a parent company called the Comfort Cub. Can you guys see it? Comfort Cub, COMFORTCUB. And what this is a weighted teddy bear. Actually has weight to it. And it was designed for mothers who may be experiencing stillbirth in the hospital. We know that mothers who experience stillbirth in the hospital, for some of those mothers, when they leave, they experience something called empty arm syndrome, because they know that they've had a baby and they're leaving the hospital without their baby, and they're very physically aware the emptiness in their arms can actually cause physical symptoms as a result of their grief. And for some of those mothers, a preliminary research study did show that just having the weighted bear, something to hold on, something to sit on their lap, something to tangible to feel with some weight to it, did serve to kind of ameliorate some of the physical effects of the grief as they navigate a very difficult journey. So this bear serves to meet that purpose and is given by donation to hospitals. So I think that's a really, really fantastic thing, and it's a great organization to support if you're looking to support an organization. So that is what I wanted to share today. One of my passions, perinatal palliative care. I'm Dr. Terry, MD. I'm a neonatologist here in Dallas. My mission is to provide light for the journey, and I can be found on Facebook, Instagram, Twitter, as well as my website, Dr. Terry, MD. Next week, we'll be talking about how we can support families who take their precious babies home from the nursery, because we know that our job does not end there. They continue to they continue to require support, and talk about some of the ways that we can support those parents and what kind of support they require. Thanks so much. I hope you guys have a fantastic Saturday and a very safe July 4th. Bye-bye.